friends. Thank you for tuning in to the Optimal Health Program. Hope you're all doing well today. As you know, I'm going to take your calls here, chat with you about topics that are important to you. We'll cover some interesting ground today. We have a very interesting, I'm going to try to make it as serious as possible, study coming out of England. And there are a lot of puns that are going to come with this topic. It'll be something that we'll have a little bit of fun with, but very important, an actual medical study with some interesting results. For those of you who'd like to look at the website, drcalapai.com, and a lot of great information there for you to take a look at. The office is 516-794-0404, Garden City office. If you'd like to take a look at all of the videos that we've put together, they're on YouTube. So you can go to Dr. Calapai on YouTube, certainly watch the podcast, but a lot of the good videos I've done over the years for stem cells with patients are there. We're going to be taking some of those things and putting them into the podcast and putting them into social media as well so people can get a handle on that. Today we're going to talk about Lyme disease. We have a lot of questions from patients that have emailed me through the website. Chronic fatigue, Lyme disease, Epstein-Barr virus, what Epstein-Barr can cause besides fatigue, allergy, food allergy, hormone decline. So a lot of good stuff. Let's just get right to it. Of course, Frankie knows what we're talking about. But in England, in the UK, where they are no stranger to odd circumstances, and the guy who wrote this article, he's actually got a really good sense of humor. James Gallagher. Very funny. I applaud him because, medical stuff could be dry and boring. So, there are organisms called superbugs that antibiotics don't work against. So, all over the world, and certainly in England as well, doctors and researchers are trying to figure out how to get these things out of your body. There have been studies and protocols and approved therapy by taking, and they call them fecal transplants, taking good bacteria from healthy people, getting rid of anything else that might be in there, purifying these things, putting them into capsules, and using them so people can take these capsules to repopulate their gut and flush out the bad guys. Now, the author, James, keeps calling them poo pills throughout this comment in the study, in this publication, which is funny. Poo pills. He also uses the word shift a lot. Paradigm shift. Shifting in the benefit of that. And if you're reading stuff on poo, the word shift doesn't always look like the word shift. So we thought we'd start off with a little bit of funny stuff here. So they're talking about using these capsules, and they're flushing out the superbugs out of the dark, murky depths of the bowel. This is the author. And replacing with a mix of healthy gut bacteria. I've had patients that have done it for Clostridium infections of the bowel and, persistent, dangerous types of diarrhea, and it works. I'm not recommending it for everybody, but it can be beneficial. Dr. Merrick was also part of the study and was done at Guy's and St. Thomas hospitals in the UK. C. difficile, Clostridium difficile, is a nasty bug that people can pick up and get really sick from, but it's already an approved therapy for that. And Dr. Merrick even uses the term poo pills, says that they're really promising in that poo pills could help tackle the rising scourge of superbugs, and that donor bacteria could help fight the microbial war. So coming to a doctor's office near you, I think, and of course, there have been no risks or side effects, and if you can get rid of the bad bugs, then why not? I think it's important to keep your gut as healthy as possible. We talk about using nutrients for your gut, glutamine, vitamin C throughout the course of the day. there are a variety of ways to help to try to keep your gut working as best it can. And that's why we do testing for vitamins, minerals, hormones, stool testing, that big, comprehensive medical nutritional approach to see what we have to fix and fix everything that we can. So the phone lines are open. If anybody still has a phone, cell phone, or landline phone, 888-420-9272, or it can just email us or text through the platform.
So thus far, most questions are poo pills, question mark? Is that what you said?
Yep. Poo pills.
You can clarify
P-O-O,
for that one.
It's a medical term. P-O-O space P-I-L-L-S. Yeah. They're using specific types of fecal transplants with healthy bacteria to help get rid of all the bad guys in the gut. So, yes, strange but true. Sounds like something out of Monty Python or some comedy routine, but it's true.
Someone's just asking, how long have these been around? Poo pills. What are you talking about?
It's a medical... Now, you can't go get these at your local vitamin shop, but it's a procedure that's been around for quite a few years and used for really serious infections of the bowel. And for people that have had, in many cases, bowel surgery and they've had dysfunction. So probably been around for a decade or two, but it's highly medically supervised, created, and is done only in that setting, in that fashion.
Someone's just asking, isn't there a risk of passing disease through these? Or?
Well, no, because it's all completely scrutinized and created under specific conditions and to some extent, sterilized. But you're using things that are only those organisms that would have benefit, and there's nothing else in it. Again, strange idea, but...
Someone must have heard us last week because they're like, I'm going to stick with the Neosporin in my nose. Thank you.
Well, yeah, that's a great idea. I've been recommending that for a long time. That's easy.
You guys are learning, and we like that.
Yep. Just, you never know when you're going to hear something crazy here. Okay, so let's talk about Lyme disease once again because I had a patient call.
Real quick, just... On that note, someone's asking, do you think pharmaceutical companies are dragging their feet on this because it's not patentable?
Probably. Pharmaceutical companies will make drugs for the most common problems because they know they can sell a lot of pills for certain disorders. For diseases that don't have a great deal of numbers in the population, they're not likely to make lots of meds and spend all the research and that money doing that. That's why you have pills coming out all the time for diabetes and weight issues and hypertension and heart, just all the most common disorders. There's tons and tons of research ongoing for meds in those worlds.
Any concern with these poo pills affecting the gut in a bad way?
No, because they're already completely created to do that good job. And remember, they're not giving you gazillions or a dose of them that would be way beyond what would be beneficial. It's small doses, and they watch to see the benefit, and they do it over time. So, yeah, this has been a highly studied process. It just seems like it's thrown together randomly.
Right. And someone's asking about C. diff. C. diff?
Yeah, they've used it for C. diff for years. That's where this first came into play. So it's totally approved for treating C. diff.
Yeah.
Clostridium difficile, it's a bad bug.
Yeah, we got someone in the chat that said they had it. They had that last year, and antibiotics did not work well, and the poo pills did.
There you go.
Wow.
We have a poo pill cure, or a poo pill positive progression. We can keep using words with P. So I think it makes a great deal of sense. So Lyme disease had a patient call yesterday, a golfer who went out, came back home, got changed, saw the bullseye rash on his calf, called, and we explained to him that it's a very specific set of circumstances we want to enact to be able to create the best outcome. So now, from the researchers and the conference I went to and speaking to some of the doctors who've been doing this for 40 years, and really some of the most brilliant doctors in the realm of Lyme and tick-borne illness, the individual's got to be on antibiotics for a good 4 to 6 weeks to make sure that you have pretty good eradication of that bug. Years ago, 2 days, 3 days, 5 days a week was never really enough. We only figured that out afterwards because people came down with more significant symptoms months and months later because the bug wasn't totally killed, or bugs per se. There may be more than one. 40% of the time, there are other organisms there with Lyme. So in having the bullseye rash, which most people don't have the bullseye rash, that's the first sign to treat it as Lyme disease. But now, within the next couple of weeks, we have to send that blood out to California to IGeneX lab to look for the best tests for Lyme, the immunoblot, the PCR, and to look for other cofactor infections, Babesia, Ehrlichia, Bartonella, etc., Anaplasma, to make sure that you know exactly what you're dealing with. Traditionally, doctors have been told for years you have to wait a month before you can test for the Lyme organism in the common labs, usual labs, but as I've been told by doctors in the know at this conference, they're still using the prior Lyme Western blot that doesn't look at every different type of the Borrelia organism. And within the 31 and 34 bands on that test, which are not there, those are the most specific for Lyme. So if you get a borderline on the local test that your doctor may run, because that's the one that most doctors would do, we still have to send your blood out to California to get a more accurate test. So this is what we're doing a ton of. Those people certainly that are outside playing sports, golfers, marathon runners, hunters, of course, out and about, certainly traipsing around after deer, anyone who's in the woods or the bushes or brush or high grass can be exposed. I know people that work in digging wells to put, gas tanks in and putting water tanks and sewage systems in that have been exposed because they're out, in a field. So it's not as though these organisms are hard to encounter, hard to find. They're everywhere. You could shake a bush that's right in the corner of your house and you'd have to be sure the bug's going to be there. And I tell people use companies that will spray your house with a natural chrysanthemum or organic substances that are safe for your dogs, your pets, and your garden, but, will help to deter or get rid of or kill some of the mosquitoes and these creatures. You have to be really smart about it.
Yeah, we got someone in the chat just saying, hey, me and my family hosting a July 4th cookout on a big grassy field. It's short grass, though. Should we be worried about ticks and with the kids running around? Let's do something fun with this. Everybody that's invited has to wear all white. Let's make it a white party. Not a white party that certain people have had over the years. Diddy who? What?
Yeah, but white pants, long white socks. Trust me on this one, because you'll see this and you'll freak out. Long white socks, and then take duct tape towards the top of the socks, like where your knee is, and put the duct tape with the sticky part out. You can twist it and flip it so that if the ticks crawl up your leg, you'll see them get stuck to the tape. White pants, make it a white party. White shirts, why not? And then you really see what your body's exposed to. I'm not sure you can get someone to pre-treat the grass, but it may be worthwhile using things like citronella candles or using some sprays to spray around the area that you're going to be in. I'm wondering if there are, accessible to the public, some of these things you might be able to bring with you and, try to deter these creatures because they're everywhere. Just you got to be smart.
Someone suggesting in the chat, we need a Smokey the Bear type creature for the awareness aspect.
There you
and
go.
I agree.
Smokey the Bear with a cool hat. I remember that.
Yeah, I mean, there's way more ticks than forest fires. I'll just say that.
Oh, yeah. They say cockroaches are going to take over the world at some point. No, ticks will be way ahead of the cockroaches. because they're everywhere and they're really tiny. You can't see them.
Depends on the nuclear blast, I guess.
Yeah. Yeah, we should check to see if the tick survived any of that. I wouldn't be surprised. It's like scary science fiction at this point. So, yeah, and then when you're out at the party, have people, check. Have them look at your back. Have them check your scalp a little bit, But wear the long, wide socks with the duct tape. You might look funny. And you can tuck your pants into the socks if you really want to look funny. People will think it's like a bunch of crazy people.
we're just back in COVID times.
A gathering. Just be smart. Because God forbid someone is exposed and doesn't know it, et cetera, et cetera. It's just the nightmare you don't have to deal with. And there are a lot of videos and movies and documentaries on Lyme disease, and there's just some horrible things that come as a result of it not being treated appropriately right off the bat.
Yeah, and someone's just asking, is DEET still the best option?
It's still used, to a significant extent. So you could spray that on your socks, on your clothes, and just get another level of protection against them. Why not?
All right, good. Well, good thus far.
This brings to mind a story from years ago in the 90s when I had a patient, I think I mentioned this last time, who had a chronic history of anxiety, depression, lots of medical problems. Didn't remember a rash, didn't remember tick bite, et cetera, et cetera. And then he had it for like 15 years. And, it was just a bad progression over those 15 years. And we're talking about stuff and trying to figure out why it would occur, because there was just no real connection or reason for it, no family history. So I said, have you ever outside in the woods, you had any tick bites or bug bites? He goes, anything close to the amount of time that you think that the problem started? Yeah, we had a family reunion. We had a picnic. We were outside, played softball, blah, blah, blah. Softball went in the woods. I went into the woods to grab the softball. I'm like, okay. I said, and you didn't notice a rash or anything? No, not really. I just felt, tired and achy and thought I had the flu. And then we ended up testing. We had Lyme. So we treated him and all the anxiety, depression went away.
And that was for what?
Took about a month.
15 years?
15 years. Took about a month, but he did so well. I was shocked. Of course, I had called Dr. Boroscano at the time and just discussed the entire presentation with him. He goes, I'm going to bet you he has it. He did. We treated him and he was fine. He was great. So,
And it shows the awareness, because I was talking to you off air.
Yeah.
Yesterday I was with a friend and he's talking about his equilibrium, this weird thing going on with his ear and all this balance. And this man, he hunts every week. And I look at him, I said, hey man, you ever think about Lyme? Like, you ever think there's a chance you got bit? And he's like, no. I'm like, you're in the woods every week upstate.
Yeah.
Like, maybe you should give Dr. Chris a call.
You're in their world.
Yeah.
So you're literally in their home. It's not hard for those things to pop on you, If you have a pet goes in the woods, comes back, and sometimes they burrow into the hair and they get to the skin of the pet, you wouldn't see them. So it's bizarre. And I'd rather be a little bit alarmist than to miss things and, not tell people that they should really take this to heart, really understand it.
Yeah.
Wear the outfit. Look a little funny. Who cares? But have somebody check your clothes. You can't see your back. You can't see all over your body, but have somebody check so that you're sure you're not dealing with something that you don't want to deal with.
And someone's saying in the chat, like, people need to realize that the bullseye rash is not what you're looking for. And people are listening. Again.
Well, the rash doesn't occur all the time. It would be wonderful if the rash occurred every time the tick came on, nipped at you and got off or stayed there, etc., but it doesn't. So you can't rely on that. If it's there, then you've been exposed and the treatment starts. And then the protocol where we do the specific testing starts. But most people don't get the bullseye rash. So
crazy. My kids are rolling around on a picnic blanket right now. Should I be checking their hands their hair behind their ears?
Absolutely, positively. Remember that the smaller larva, which is the almost invisible Lyme baby, newborn maybe, and then the nymph are very, very difficult to see. It'd be very hard to see it unless you're really looking closely with a magnifying glass in your hair. And then the adult is obviously bigger, but yeah, anytime kids are outside, check them when they come in. Make them wear white. Check them. Make them wear high socks. Just do it. You find the tick, you get rid of it before it gets, embedded. Yeah, just do it.
And we got someone that got Lyme last July. They say that they still feel off.
Well, the question would be, at the time when they were exposed, how long did it take before they were treated, and how were they treated? How long did they take the medication for? And which medication? That's super important to talk about. So let's see if we can get that information.
Yep. Yeah. Comment. We're monitoring. Yeah. I found out when I thought I had my first tick bite, I've said to Dr. Chris, I went to the doc in the box and they're like, yeah, you could just, if you need, there's no circle, there's no nothing. We can give you the antibiotics if you'd like. I'm like, yeah, give me them all. And now I find out, a couple of weeks ago that wasn't even enough. So good to know I don't have it, but could have sucked.
It's always been an issue where, and rational doctors don't understand why people don't take the course or read up on it or go online or do something. ILADS, the organization that creates all the conferences and such, they're a great organization. They teach people a lot. There are books. You can get a ton of information from them to really educate yourself as a physician, dealing with Lyme disease. I don't think I have a phone number here, but it's the International Lyme and Associated Diseases Society, ILADS. Just go online. And everybody can go online and read about it. Just learn, be smart. It's the number one infectious disease, and now the numbers are staggering. They're rising like crazy. And part of me doesn't understand why the manufacturers who make the antibiotics specific to it aren't creating more awareness, or maybe the Department of Health not creating more awareness. You should see commercials on this all the time. Maybe we need to do a commercial on this.
Yeah, and that's what one of the chatters just saying. Why is this totally ignored by the CDC? It just feels like people are not educated at all, especially on a day where we celebrate freedom. I believe we're on July 4th.
It's weird because you have all this information coming out about other things, but Lyme is so much more common. But you have information in awareness groups and chat groups and support groups about everything else, but you don't really see any of this for Lyme. Maybe time to and this is what we're trying to do with the podcast, get the word out.
And someone's just asking, do you think the stem cell therapies that you do they help with the Lyme fatigue?
Well, some people that have damage and degeneration, you're going to see improvement. We've seen it with patients that have had damage to the lungs from COVID. We've seen it to patients that have had joint issues from a variety of circumstances, rheumatoid, and even infectious damage, So infections are not things that just sit there and make you feel achy. They can create a lot of damage. We've had patients with Lyme disease that have had arrhythmias and heart problems. And we know arrhythmias respond really well to stem because you're putting new cells in to repair the damage of that tissue. So that's part of the armamentarium, or part of the weapons that we use to fight whatever we're fighting or dealing with. It just depends on how people present.
Listen to this one. I make my own natural tick repellent from garlic and apple cider vinegar. I'm not crazy. I'm just ahead of the curve. All right.
That's great. Why not? Be smart. If you can get something that has some kind of proof that, it's working, there's got to be some literature on it, then absolutely. Why not?
And if I find a tick on me while camping this weekend, I'm just ripping it out and pouring whiskey on it. That's my only option.
There's a cool little thing that I saw, and it's about 1 inch or so across, and it's a metal device, and you're supposed to press it on your skin and pull it so that it can just elevate the tick and get it out of your skin. I forget the name of it, but maybe we could find, and maybe Amazon has it, a tick removal device. But I saw this in a store, in a pharmacy. So you would take this device, there's a hole in the middle of it, and as you pull the device backward, the tick slides into a little groove, and you're able to pull it out. So, yeah.
It's like a bottle opener.
Kind of, yeah. It's a weird-looking little thing. But I think it makes sense because you'll probably get a better removal and you can send it to the lab at the doctor's office.
Yeah. Wow. Especially if you got dogs, easy with the fur, you know?
Yeah.
Cut right through that. I'm going to need one of those on my keychain, and everyone should be listening. We might need a promo code for that one, Doc.
There you go. Let me see if on Amazon they have a tick removal device.
I'm looking at one, $9.99. The original tick key, they call it.
Tick key.
There's a few different options, some different shapes. This is genius.
Tick removal tool. Yeah, that's the one I saw. It looks like something that actually you could put on your keychain. Perfect idea. So, yeah. Everybody knows somebody who's had Lyme or who's had tick bites, etc., and the numbers are just increasing like crazy. So if 500,000 people a year in this country are diagnosed, there are a lot of people, maybe the same number of people that are not diagnosed that might have it, but didn't get the rash, didn't get immediately horribly sick and didn't go to the doctor, or maybe had a sore throat, got an antibiotic for the sore throat, which helped to calm down some of the Lyme symptoms, and then they weren't tested for Lyme. There's kids that can't tell you exactly how they're feeling. So the reality is there are a great deal more people that have and that don't know it than the ones that know it.
Yeah, and just to our last commenter, the whiskey isn't gonna, we can't confirm. Whiskey will not cure the Lyme. You must call Dr. Chris. All right, call the office 516.
It's funny to think, back in the day, before antibiotics, the different things that people did to try to help themselves in a variety of ways, but. Whiskey and alcohol was used for all sorts of things. Pour whiskey on the wound. Here, drink this, so when we take your leg off, it won't hurt as much. And you watch some of these old movies, you're like, wow.
Brutal.
All righty. Let's see if we can get a few more questions here. Sort of pertinent to this, there are a lot of people that have chronic fatigue syndrome that have Lyme disease. So chronic fatigue is supposed to be fatigue that lasts for more than 6 months, that, most of their ability is decreased, they're tired all the time, they're achy. You may or may not find blood tests showing high monocytes, which point to a virus, or high eosinophils, which could point to either allergy or some sort of inflammatory mechanism or infection or parasite. There is a CD57 test that tells us if your immune system has become weak, and that's kind of used as an adjunct test for Lyme, if you know you have Lyme, because there are studies that show that Lyme does knock down your immune response. Speaking to a lab, T-Labs, out in California, where we're going to start doing biofilm testing. And if the whole Lyme thing doesn't boggle your mind, biofilms are organisms that can attach to or wrap around Lyme, make it hard for your immune system to attack it and for antibiotics to fight it. So now, for those individuals, we want to test for biofilm. A whole new frontier. And, a year or 2 or 3 ago, I've heard about biofilm, didn't really see much on it. Now, when you go to a conference at Drexel and all these high-profile doctors at different facilities are talking about biofilm, you have to take it into consideration. So...
just on the chronic fatigue situation, someone said, I sleep 8 hours a night and still wake up feeling like I haven't slept at all. Is that typical with chronic fatigue?
Well, yeah, although the term chronic fatigue or chronic fatigue syndrome, I think, is the beginning of the sentence. It's not the end of the sentence. So I might say you have chronic fatigue syndrome caused by heavy metals, or chronic fatigue syndrome caused by thyroid decline, low levels of IGF-1, which is important for sleep, Epstein-Barr virus, and or Lyme disease. So chronic fatigue syndrome is the beginning of the sentence, but we have to define why it's there, what causes it. Some people have autoimmune disorder and chronic fatigue. Some people have low iron. So it can be a variety of different things that can correlate with that. So what you feel is the result of a variety of things happening in your body. Sometimes different organ systems are involved. Sometimes different organisms or pathogens. So depends upon what we find.
Someone's just saying, my blood work always comes back normal, but I still feel exhausted all the time. Are there markers that I could be missing?
Well, yeah, I'd be willing to bet that you're not getting the 25-page blood test that we talk about. So blood tests being normal all the time, in many cases, are just a CBC, a chemistry. Sometimes doctors will do iron if they feel you're tired, or women have their iron blood test done all the time because of the loss of iron every month when they have their period. That's a common test to do. Sometimes doctors do a 2-part thyroid test, which is not enough. So, the normal tests that are fine or normal all the time, they may not be looking for enough.
We got a long COVID question. How similarly is long COVID to chronic fatigue syndrome? How similar is long COVID to chronic fatigue syndrome? Are doctors treating them the same? Because I've been having the same
I don't think doctors are treating either of them well. And if it's just putting medications on board, you're not changing that much. We've had long COVID patients that respond really well to vitamin C IV therapy, and that's been documented. We've had people that have results with correcting, vitamin B12 because maybe they don't convert it, they don't methylate, and in doing that, B12 creates energy again. Vitamin D, very important. We have people that have long COVID that also have Lyme disease. We have people that have long COVID that have Epstein-Barr or cytomegalovirus. So it's hard to say that you only have one thing or one term, or just follow that one term and wait for a medication to try to treat that. So we have to look at long COVID and chronic fatigue and understand all the underlying contributors to that, and then start changing that mechanism. So in patients that have had inflammation with long COVID in lungs, we've done stem cells to repair their lungs. And now their lungs are great, and that issue is gone. So it really depends upon what we find behind that very generic term, chronic fatigue or long COVID.
Someone's just asking how the stem cells bring down inflammation exactly.
So stem cells will go to areas of damage and degeneration and become brand new cells. And the inflammatory cells don't last forever, but if the mechanism is to contribute to and keep making the inflammatory cascade with a variety of different cell lines, if you're putting brand new cells in there with great function, and part of their process is to reestablish their effect on repairing your tissue, then that's part of the mechanism that shuts down the inflammatory cascade. So yes, for people that have a heart attack, if you do stem cells, they'll go to the area of damage and degeneration in your heart, and inflammation occurs when you have cell damage and death, but you're putting brand new cells in to take over that job that those damaged and dying cells can't do. You're creating repair. So that's one major part of that process. For lupus and rheumatoid, same thing. You're putting brand new cells to work, and they do their job, so they're decreasing the inflammatory cascade. It's a little bit more complicated than that when you look at CD4, CD8 cells, and all the different cells involved, but suffice it to say that you're repairing and creating great function where damage and degeneration was leading the way before.
All right, couple things on the, it's been a little while since we've had a good, nice stem cell conversation, and someone's saying, hey doc, I heard you're helping veterans with traumatic brain injuries using stem cell. How does that even work?
So the understanding of stem cells is pretty simple. Just like your antibodies are attracted to areas of infection, and you have B cells and T cells and macrophages and lots of antibodies to go and grab something and kill it, bring it back to your lymph nodes to kill it even further. That's what your immune system does every millisecond of your life. In the same way with exquisite chemical messaging, stem cells are attracted to damage, degeneration, and inflammation. So for those individuals that have damage to brain cells, that surrounding cascade is what stem cells are attracted to. So, of course, when we extract, spin the stem cells, do an IV, and then we drip the stem cells into the nostril to hit the back of the nasal cavity and get into your brain, it goes to where your brain cells are damaged and becomes brand new brain cells. So just like stroke, MS, Parkinson's, Alzheimer's, traumatic brain injury, cluster headaches, and you can see all the videos on YouTube, and the website, you'll be able to see how putting new cells that can become anything will make brand new brain cells, and now your neurotransmitters are created again like they were before, and that's what creates your best outcome. You're making brand new cells out of stem cells for every area of damage.
I have bad arthritis in my knees. Would stem cell therapy be a real alternative to knee replacement?
Absolutely. We have lots of patients with shoulders and hips and knees and ankles and elbows and feet, low back, where we've done stem cell therapy. I'm not saying you should take a person that has a hip socket where the ball, which is supposed to be round, is now completely broken down, and you're not going to grow that bone back to the right shape. That person needs a hip replacement. Or a person who has so much damage or who has bone degeneration and fracture within the knee, etc. Same idea. But overwhelmingly, patients that I see will typically go to their primary doctor to check out the joint. He might recommend an x-ray, or he might not. He would typically refer people to an ortho, the surgeon. They do the x-ray in the office, and the x-ray is not as good a test as an MRI, so I see this all the time for many, many years. I want to see the MRI because I want to see every part of the joint, not just the outline of the bone. People have seen an x-ray. It's white where the bone is and dark where there's no tissue because the x-ray goes right through, doesn't bounce back to be picked up on that x-ray plate. So the MRI shows ligament, tendon, cartilage, meniscus, discs, labrum, everything, and you can see how much wear and tear there really is. Now, if you're doing an x-ray and on a physical exam, a patient can't lift their arm up and throw a ball, you question the supraspinatus, infraspinatus tendons, and you question the labrum. But there's no question when the MRI shows you the entirety of those tissues as if you looked at a slice of millimeters of every millimeter of those tissues. So you have a good handle on whether or not a person needs surgery or not. Now, if you were to take a shoelace and cut it in half, or a tendon or ligament and cut it in half, it's got to be reattached and sewn so it gets its integrity back and you have that connection again. If it's not separated and it's frayed, you certainly can do stem to create repair. But if it's completely separated and waving in the wind, you've got to take them back, overlap them, and accurately reattach them. And sometimes you have to put in anchors for those ligaments of the shoulder, etc. So it depends upon what the MRI shows. That's the best picture.
You're blowing people's minds, Doc.
Yep, trying to give them a good little explanation of things.
Yeah, we got a question on... my mom has a diabetic foot ulcer that won't heal. Could stem cell therapy help regenerate the tissue?
Absolutely, positively, without a doubt. And we've done a lot of this. So we have a lot of people that come in with diabetes. And most of our type 2s over the course of a few months have such an improvement in their pancreatic function because you're putting new cells into the pancreas. Now the pancreas has younger cells that are making insulin. You start to change the sugars, and some people become non-diabetic in 2 to 4 or 5 months. We also would take some of that stem, remember, because we're doing IV for diabetes. We also would take some of it and inject it right around the crater of the ulceration, and that can make it heal fast. We've done that with heel ulcers, with patients that are stuck in bed for a long period of time. We've done it for a lot of ulcerations in skin. But for diabetic ulcers, it works really well.
And what kind of results have you seen in your patients? Are we talking full recovery or just symptom relief?
For the ulcers, full recovery. Some people with those ulcers would never heal, and it would never close. And doctors debride and cut away dead tissue. But as you put new cells in there, those cells become functional and create healing and close up that wound.
And just a couple questions. The general questions of where are the cells coming from and that whole process.
So the best cells are from your body. There is no better cell somewhere else, and certainly someone else's body, like umbilical cord, you could reject. with umbilical cord as well. You don't know the genetics or the infection history of the donor. You know nothing about the donor. You don't know how old the cord is, how long has it been frozen, how many cells die when it's frozen. What are you really getting? There's no way to quantify or test that, so that's why the U.S. doesn't allow that. Your own cells are perfect, and they have the same language as all your other cells, so there's no confusion, there's no rejection. So the crest of your ilium, where on the right side your belt sits, and this is sort of a little model that shows the iliac crest. If we follow that crest backward, it becomes a little fat bump. That's the area that we go to because it's easy to extract from that spot. It takes about a minute and a half to extract once we sterilize and numb the area. We're taking about 60 cc's of fluid, which is bone marrow. We then spin it in a high-speed centrifuge, separating red blood cells, plasma, and stem. Take the stem from the bottom, and then we have them to use to put them back in. Injection to joint, IV nebulizer and for lung, IV nasal for brain. So it doesn't take more than a couple of minutes to extract, half-hour spin, and then we put them back in.
All right. Chat's flying. All right. A few different
awesome
routes. Obviously, the question of are most of these therapies FDA approved? Are they considered experimental, and why isn't it everywhere?
The FDA controls drugs and devices. The FDA cannot control your cells or your body. The FDA does comment about the fact that they don't like umbilical cord stem cell. And the comment is that you're not allowed to manipulate stem cells. So in their own language, the FDA says, if you extract them, you spin them and put them back in, that's fine. So there's never been a problem with that. The FDA never liked aborted fetal cells, appropriately so. The FDA doesn't like umbilical or amniotic fluid. And it's relatively simple and clear for those obvious reasons. So taking them out and putting them back in is 100% fine, legit. That's, as a matter of fact, the only thing that they like, because they don't like any other. There were doctors taking out your cells and then treating them and incubating them, etc. They don't like that at all. As a matter of fact, for a while I had friends in the Bahamas, and I was trying to see if I could set up a stem cell facility in the Bahamas. I had great support from different people. I mean, giant people in their field. Giant. There's a gentleman, a Greek guy, very nice guy, who produces all the cement in the Bahamas. Very, very big family. Great people. He supported me and, made a call. And another gentleman who was a big shipping guy made a call. Another guy owned another very big company. And the problem was, once you get to speak to people that are there in the administration, and it changes every couple of years, there was a person there who did not want this to happen. And this was a doctor, consultant, and just blocked it every time. And then I found out I found out something that made me understand why they didn't want me to be there, because
they're making money elsewhere.
Yeah, I'm not going to say that directly, but you did, but that's fine.
Exactly. It's my job.
So, yeah. So.
That's wild. Crazy. People are asking, I've heard mixed reviews on MS being treated with stem cell. Is there hope?
There's absolutely hope. We've seen wonderful results with our patients. You can go to YouTube and look at a video. Frankie and I were looking at those videos a moment ago because we're going to take nice clips from those videos and put them on social media and put them on our podcast here. Of a gentleman who was in a wheelchair for 6 years. And before that, he was a very active guy, big rodeo guy, and he's got, awards all over his house. We had a videographer go to his house and have him tell his story. We did stem cells IV and nasal for him. And over the course of a month, he was able to keep trying to stand up out of the wheelchair, push himself up. At about a month's time, maybe a little bit longer, he was able to stand up. And then when we had the videographer go there, he was able to get up out of the wheelchair without struggling or pushing, or he just leaned forward, stood up, and he walked. So the results can be dramatic. there are people that have gone to Mexico, Panama, Costa Rica for STEM, and they're paying literally through the nose because they charge way too much, and there's no reason for that because this doesn't cost much because you're getting someone's cord, frozen cord. And we had a patient that we treated with great result. She went down to Mexico to see what it was all about, wanted to see the facility. They wanted to charge her $60,000. And I said, that's insane. Why would they charge her so much? Usually they're charging $30,000, which is still too much. They wanted to give her chemo before they gave the stem. And I said, there's just no reason for that. Why would you put chemo on board with a brain that's already struggling with a neurologic issue? It just made no sense. So sometimes if it's done the wrong way and not done the appropriate way, you're not going to see much result.
Crazy. Any comment? Someone's asking about remember that crazy guy that was taking blood transfusions from his son? They're curious on your thoughts on that guy, the vampire man, as they call him.
Taking blood transfusions from his son.
Yeah, it was blood plasma transfusions, and he would do it every day, and it didn't seem to have worked for him. But they're curious.
That's really not going to work. I mean, people have the craziest ideas.
Leave it to the billionaires.
They get on some sort of thought, and without really consulting someone who has all the knowledge that you could want about these things, they just decide that taking a younger person's plasma is going to change their life or body, and it will not.
Yeah. And to the question, the person who asked that question, I just did a quick Google, and at the end of it, it says he has since stated that he did not detect any benefits from the plasma exchange with his son and has stopped. So there you go. Listen to Dr. Chris, all right?
A risky thing to do with, and again, a lot of people out there want to try stuff because they think they know better, and they've got a better idea than the doctor, which, people will do.
Yeah. And I got a couple comments just basically saying this is anti-aging.
Stem cell is exactly anti-aging because if we just describe the specific nature of putting new cells in your organs, and if you're doing an IV, new cells can get to everywhere in your body. New cells, your heart, lung, liver, kidney, pancreas, gut, brain, eyes, etc. The anti-aging comment is that you're putting new cells there, so your function now is being regained, so you're decreasing the age-related loss of that function. And I have people where we've done scalp for hair, we've done stem cells for facial repair and rejuvenation. Stem cell is really the only true anti-aging concept. You're not going to live to 300 years of age, but as your pancreas is now working better and you're non-diabetic, you've de-aged, you've reversed the damage to that pancreas. If it's so for the heart, lungs, liver, any other part of your body, it just makes all the sense in the world.
Why is it so hard for regular people to get access to legit stem cell care? Do you have to be rich or famous?
Don't have to be rich or famous. I mean, our cost for STEM is dramatically less than what you see, as I mentioned, in Mexico, Panama, Costa Rica. So people just need to hear and learn and look and listen and, ask questions. So apropos to those facilities in Mexico, Panama, Costa Rica, and even Europe, some places charge $30,000 to $60,000. When I got my training done, and the company that we worked with, they were somewhere between $12,000 to $15,000. And they didn't have a cost for a little elbow or a wrist, a smaller joint. We negotiated them down. So our cost or charge for STEM for the joints, any of the joints, is $5,000. There's no stem cell therapy for $5,000 anywhere, but we were able to do that. The cost for doing the intravenous treatment is a little bit more, but it goes to your entire body, so it ends up being about $7,500. That's not $30,000 to $60,000. So I made that the discount. And for people that want to do two joints, the first joint's $5,000, second one $2,500. I put the discounts in there with the company that we buy the equipment from. That's what I did when I started. So absolutely, it's just a matter of learning and looking and hearing a little bit more information.
And I see a Google Scholar ad coming in the distance, but. Is there a central database where patients can actually see results or trials?
For what?
For STEM.
There's no central database for anything, really.
Right.
You couldn't find a central database for heart disease results with drugs. I mean, there are individual studies, And what you see throughout medical literature would be, and you could look up beta blockers for heart disease or diuretics for congestive heart failure. The studies are there because they've been done ad nauseum over the years. You could look at videos that we have on YouTube to see stroke, MS, Parkinson's, Alzheimer's, joints, people that have done it. So that's the most reliable and realistic comments you'll see. But even in all the traditional medicine realm, there's no centralized database where every doctor puts information as to their results for treatment.
Google Scholar's got some good stuff, though.
Love Google Scholar. I talk about that with patients every day.
Oh, I like this question. Do you think the VA will eventually cover stem cell treatment for things like PTSD or TBI?
No. The VA is an organization, and everybody has heard about this over a long period of time, that doesn't really offer a great deal. I've had more patients that have been to the VA and have had complaints of waiting in the, waiting room, and everybody knows and has heard about, there are veterans that have passed away in the waiting room because they weren't administered to quickly enough, and that was in the news about probably 4 or 5 years ago, 6 years ago maybe. So it's not a cutting-edge facility that's going to find the best and do the best and have all the best research there. Traditional medicine research is done for the most common disorders, and typically the money for the research is created for drug research. And drug companies will do the research to sell the drug. But most people know that. In a perfect world, I've been trying for the better part of 7 years to reach the right people to get something done for veterans. Still working on that through two very important avenues. I don't have an answer yet, but as soon as I do, if I can make some headway, then I'll announce it. Got some very good connections now. But, wanted to do this for a long time, to do stem cell therapy for wounded veterans. So, I hired someone who is a political consultant to go out and go to big organizations to try to raise money, but big organizations didn't want to put money to this. It's not crazy money either. Sponsor 2 or 3 or 5 people, It's odd, And there are organizations for different diseases, but it seems like there's a connection for the new drug research for that disease. You don't need more new drug research for the disease. You need something that's going to repair your body and correct the loss of cells to create benefit.
You'll be the first to know, by the way.
Yep, absolutely. I promise that.
I've heard someone, I've seen someone who was paralyzed started walking again after stem cell therapy. Are these things actually happening?
Yeah, they are. I've seen it. I can't comment on every patient that has had paralysis or the type of paralysis. In years past, they used to inject stem cells like an epidural injection. You'd curl up in a fetal position, then they would pass a big needle between your vertebrae to get into your spinal canal and inject the stem there. Since the nasal procedure is being formed with doing drops into your nose, which gets into your brain and your spinal fluid, I don't see the need for doing that big needle epidural type injection. So I think that's taken over because there is some risk with that big needle injection compared to doing a nasal droplet.
You've touched on this already, but we're just getting questions. Oh wait, where'd you go? They're just kind of asking about George Bush back in the day having problems with stem cell.
Well, the only thing he had a problem with, and people bring this up often, I hear it every week when people say, "Oh, George Bush." Some love him, some don't. Now that there's more information that's come out about all sorts of behind-the-scenes things. But he continued a ban on aborted fetal tissue. He didn't do anything else. He maintained a ban on aborted fetal tissue stem cells. He didn't interfere with your own stem cells from bone marrow or from fat. No one has ever interfered with that. So that's always been available. But rightly so, you don't want to make a whole industry out of aborted fetal tissue. And there are some stories that have come out about that.
Yeah. And as the chat is saying, who would want that in their body?
People should research that and see what's done with aborted tissue.
Crazy. Could we one day customize stem cells to match a patient's DNA for hand? I don't know what that one means.
Your DNA is already matched. It's
right,
your stem
yours.
cells, your DNA from your body out and back in within a half hour. So you couldn't get better than that because they're your cells, your DNA, your language. So.
Athlete question: tore my rotator cuff playing softball. Surgery did not work out very well. Is stem cell my next move?
Absolutely. And in a perfect world, stem cell would have been a great first move because you can put the stem right to where that damage is and have it create repair. So for a lot of people that are told they need to do a surgical procedure to go in for a cleanup or a little looky-loo, as I think some of the orthopedic surgeons do, because they want to get a better picture, go in there and see exactly what they can see, move things around. And there are great orthos, The question is, with an MRI, how much wear and tear do you have? If it's not totally separated, you certainly could try the stem. And most of our patients who've done that have had great outcome. Again, there are 20, 30 some odd videos on YouTube for patients that we've seen. A gentleman who fell off of scaffolding, damaged his shoulder and his ankle. Great result with stem. Another guy was a big jiu-jitsu guy, and he tore his labrum on his hip. Did really well. He won a competition 6 months later or 4 months later after stem. So, yeah.
And just one on dementia. Has there been any studies on that?
Absolutely. We've had patients with memory loss and dementia. When you do the intravenous and then you do the nasal droplet where you're putting it into the back of your nasal cavity when you're lying on your back, it gets into your brain. And we've seen people with MS, Parkinson's, Alzheimer's, stroke, and dementia patients have pretty dramatic improvement because you're putting new cells that become new brain cells, and they're making your neurotransmitters again. So, and there's a video on the website of a gentleman that had dementia and foot drop, and he had pretty dramatic benefit.
All right. Looks like we're up to date. Oh, another one. My brother has ALS. Are stem cells part of any real treatment plans?
Stem have been used for ALS. Some people have stabilized and have not progressed and become worse. That's one of those disorders that's hard to completely understand, and most doctors don't understand it. If you can stabilize it, it doesn't get worse, that's a good thing. I don't think anybody can say that it'll reverse and change the course and the person has no, defect or no problems. But I think even individuals who can minimize or stop the progression or hold off the progression, that would be a benefit.
All right. What else we got? There's a local spa that's offering stem cell facials and IV infusions. I don't trust them.
A local spa?
Yeah.
Part of that problem is if it's a spa, there's really no doctor involved. So what are you getting? They're buying stem cells from some facility outside the country, and you're getting someone's cells or tissue, maybe. Maybe they're using plant, which is a joke. But you don't know anything about that tissue. And why would you inject IV or inject something in your body that's completely foreign? I would never inject foreign cells into my body for any reason, shape, or form. Your own cells need to be used. But there are always going to be people that say, oh, yeah, hey, let's make believe this is like your own stem cell, and let's order this and do this for people and wing it. It's just not worth the risk.
No.
You know, and I say this all the time. I'd say this in the office. I tell people, you ever watch that show Botched? With the two surgeons, Nassif and Dubrow, really, really qualified, great surgeons. And they're funny. It's a great show. They repair the bad plastic surgery done in other countries, where there's really no standard that a doctor has to meet, whether in training or whether in fellowship, and the ability to do wonderful things like our doctors in this country do. Because those guys that get to that level are some of the highest and best trained doctors in the world. Why would you go to another place where you don't have the best doctor doing that treatment? You're just taking a big risk, especially with your face, especially with something intravenous. I mean, it's just not worth the risk.
Yeah, no, that's terrifying. Actually, my worst nightmare. You don't go to a spa for something getting injected. I'm sorry, right? Am I crazy?
I don't see how a spa can do those things.
Like, you couldn't pay me.
I've seen patients that had a girlfriend years ago who went to a spa to get laser done. But they burned her, and it left white spots on her skin of her legs because they just didn't do it right. You know, the frequency of the laser, the width, it's a lot that you have to understand when you do that. You have to start off very slow if you're trying to zap, hair, etc. So you just don't want to go to the least credentialed place to do things. You want to go to the best place to do things. I'm not saying if you want to do Botox, you go right to the plastic surgeon who will charge way more than everybody else, but there are GPs who are well-trained. There are dermatologists that are well-trained. You wouldn't go to a doctor to do a facial procedure on you unless it's a plastic surgeon. I mean, I wouldn't, if you get cut, if you have some kind of injury or damage, you've got to go to the best qualified person.
Just a question. My son has cerebral palsy. I've seen stories of kids improving after stem cell treatments.
Well, you're putting new cells into the area, which would tend to create better neurotransmitter, delivery. Would be curious to see and look maybe at a SPECT scan to look at metabolism of the brain. We do that for a lot of patients that have brain-related changes, stroke, Parkinson's, Alzheimer's, MS, etc., and see beforehand, and then maybe do it afterwards to be able to see increase in perfusion or better metabolic, benefit. So there's the potential there. We've done it for kids that are autistic, but usually those that are 15, 16 years of age and older. So you're just putting brand new cells in to try to create more repair and healing. The essence of cerebral palsy to some extent is hypoxia during birth, and the brain's not getting enough oxygen. So some of those cells are damaged and will die. Some of the cells may linger and not do well. But even for people that have had, as I say, traumatic brain injury, strokes, you put stem in, you're putting brand new cells in there to make new neurotransmitters. Again, I'm not commenting on one individual and say, well, I think this or that, because I don't know until I evaluate the person. But
I just want to say I'm proud of the chat today. This is a great Monday.
Yeah, great Monday. People, it's too hot outside. People are staying inside. They're watching and listening, and we're chatting. It's good.
We love it.
It is hot outside.
It's too hot. It's too hot. Yeah. Someone's asking, could I use stem cell if I'm too hot?
You might be able to. I have two big dogs, and they're full, long hair, very thick coat dogs. So sitting outside doing some work in the garden yesterday, I kept having to take, and I took I got smart, a big bag of ice, you get at the store, and I would dump it into big buckets of water so they had ice water, and they were drinking the ice water like crazy, hanging out under the trees. They kept bugging me because they want to be scratched. I'm like, oh, God, please. I just want to relax, do a little gardening. And Zeus is very chill. He's just a German Shepherd. He's just laid back. He's cool. He'll watch, and he'll intently watch what I'm doing. But Delilah has to stick her nose in everything. So, she needs to look at why I'm doing this or that or putting the water here or there. And it's just funny. Her personality is just funny. She's like a little kid. She's constantly looking at every little thing I'm doing. And of course, when I go to take a little nap and I relax, I'm laying in the sun, her cold, wet nose and her big paws have to just, hit upon me at some point. When you're about to fall asleep, you're in that little twilight sleep thing and have this cold nose in your neck. It's like, ah. Yeah, so she needs a good amount of attention.
We'll have her in one day.
Yeah.
One day.
Somehow we'll do it.
It might be a little distracting episode, but
yeah,
I think it's worth it.
But I was going to say, maybe we can bring her to the Marriott. So a friend of mine, colleague of mine, Amy, who owns a nursing company where she sends nurses to people's homes and takes care of a lot of people. Wonderful, wonderful, business. We're thinking about doing a lecture at the Marriott Hotel within the next couple of months. I'm going to email all my patients. We'll announce on the radio program here over and over again. If you'd like to come to that, it's probably going to be a Saturday afternoon. We will probably shoot the podcast from that destination. We're working on that now. And if you'd like to come, you could either call us, tell us, call the office and put your name on a list so we can see the size room that we need to get. I think we're going to need a big room, but we want to try to get a head count. And as well, Amy's going to do a mail out to all her patients, contact them, so we should have a really good crowd.
Let's go. Live, baby.
Yep, live. Back and better than ever.
All right, chat. They want the dog in, by the way.
Yeah.
They want Delilah.
It's
everybody
loves her. I have people over the house that hang out with her all the time. They don't even hang out with me anymore. Which is all right. She loves attention. She just doesn't realize how big she is.
Well, when you grow, what was it, 40 pounds a month?
25 pounds a month.
25 pounds a month.
For the first probably 6 months. Just bizarre. It's like, oh, look, cute little puffy dog I can hold in my hand. Then all of a sudden it's like, I can't really hold her anymore.
It's been 2 months.
And then I pick her up under the arms now. I mean, she's all squiggly, so she's always moving around. So I try to pick her up. It's just ain't going to happen.
Chat's quieting down.
That's good. We're here an hour and change, so a very, very good show today. A lot of great calls. Thank you all for listening. God bless you all. Have an amazing day. We'll be back here again on Friday and then Saturday. Our big show day, last Saturday's show.
Oh, yeah.
We did over 89,000 views.
I think 87.
87,000 views. It's pretty amazing. We love our Rumble audience and all of our people that listen from YouTube, Instagram, Facebook, Spotify, and the other 20 platforms that we're on. I'm very, very appreciative of it and love getting your questions. It's a lot of fun. So my voice is still holding.
Just made it.
Have a wonderful day. We'll be back here on Friday, 12:30, and Saturday at 2:30. See you then.